World Health Organization promotes Indigenous primary health workers as leaders in addressing health inequality. And here in Australia, this workforce is gaining strength. Located in the CBD of Adelaide, Wuchopperen, meaning working together, is a community-controlled centre, providing culturally appropriate healthcare and community support services to Aboriginal and Torres Strait Islander people.
How's it going today, all right?
Yeah, pretty busy, man.
Pretty busy?
The service aims to overcome barriers which exist for Aboriginal people in accessing and using mainstream health services.
I like the basic Aboriginal health worker's role. It's not boring, never boring. There's always challenges. I enjoy being on the ground and helping people as they walk through these doors. Now, what brings you to our clinic today, brother?
Just a basic health check.
Anything in particular that you're worried about?
No, not really.
Feeling well?
Yep, feeling well.
All right. I got into Aboriginal health just by chance, actually. There was a job vacant for 3 months, which I filled, and continued on from there 10 years later down the track. So giving me the opportunity, I've walked in and enjoyed the job, did the training, and been here ever since. When the last time you've been to see a doctor?
No, brother, I don't really go to the doctor.
Well, what we might do, we'll go through a Aboriginal health check, and then we can screen you for that as well. The basis of what I did with the client was just sort of initial screening prior to seeing the doctor. We do that with every client that walks through our door. We do a pre-consult, basic obs, history, and which makes the jobs a lot easier for the doctor. You on medication at the moment?
No.
No. Allergies?
No, no allergies.
We'll check your blood pressure, and also we'll check your height and weight, and then you can see the doctor.
Yeah, sounds good.
Okay. The initial consult can be more complex and bigger with all the underlying issues that a client tends to share with you. Yeah, the client said he had a poor history, didn't trust the doctors, they don't get a proper service, they don't get heard. Cool, thank you. The consultations are short and then they're gone. We do a really extensive pre-consult with the doctor as well, and the follow-up process was really good as well. The clients do come back to review their results and explain to them in a easily way. Anyway, brother, where are you from? I haven't seen you around here before.
Yeah, I'm around the area.
Yeah. Who's your mob?
I don't know who my family are. They were taken away.
I asked him if he was a local lad, which he kind of said he was, but I didn't know much about his family ties.
No, I've been doing a lot of looking by myself, really.
Yep, we've got a Linkup program here. They help reconnect families who have been taken away. We can refer you on to those, and hopefully we can find some of your family.
That'd be awesome.
Be awesome?
Yeah, it would be. Okay,
cool. With me encouraging him and introducing him to the Linkup staff, he was happy to accept that request. It's good to find family history, then you can get into more depth of why they're here, what's going on in their lives, how they're feeling. We'll pick up things before they get worse. Now we'll do a blood sugar level test, which means we'll test the sugar that's in your system at the moment. It'll give us a reading. It'll be just a small prick on a finger, and it should give us a reading within 5 seconds.
Okay.
Here we go. Let's do it. We're not just clinical health staff in a medical model. We look at all the experts when they come in to see us. There's a big social side as well, the reasons why they come in, and there's a lot of underlying factors that play a big part, and we tend to dig deeper and find out and fix those problems as well. So next, just a basic consult can turn into a big event for all of us. All right, mate, that reading looks a bit high today. It's around 12. The doctor might chat to you more about it. That's a reading of around a borderline diabetic. So what we need to do now is run some more tests. And
Okay.
You feeling okay?
Yeah. Bit worried.
Bit worried? All right, well...
If you go get the doctor, are you going to be with me?
Would you feel comfortable if I was there with you?
Yeah, well, that's why I come to an Aboriginal medical service.
Not a problem at all. No, I'll sit with you throughout the consult. We'll make you feel as comfortable as you as possible.
You know, we don't have a very good history in our family with seeing doctors.
I understand. Like you said, us health workers are here for you throughout the consult, so...
Thanks, brother.
Cool.
Appreciate that.
Come in.
G'day, David.
G'day, Sean.
Got your next patient. This is Jodis.
Oh, g'day, Jonas.
Jodis, this is
Dunn.
David. Dr. Dunn. He's been here for a number of years now. So, yeah, he's going to be your doctor today.
Yeah, come in.
All right, come in and take a
Have a
seat.
seat.
See him through the process today, from the pre-consult to take him in to see the doctor. And Jodis was a bit reluctant to see the doctor alone, and he felt more comfy if I come in and sat with him. So here we are.
All right, no worries. Well, it's really good that, you know, with that health check, the blood sugar was picked up, because it gives us a chance then to work together.
I think it's important to allow the client to open up a lot more and get some trust going with him, myself and the doctor, and we can better treat his illnesses then.
We do have a diabetes health worker who you could see if you were interested.
I'll introduce you to the diabetes educator. She's a nice lady, and we'll go from there, and then she can explain her role, how she can help you. And like I said, I'll be there with you from every step of the way.
We can work on this as a team.
I just enjoy helping my community. The results, the follow-up, and you see people get well, which is really rewarding, I guess. So that's why I enjoy my work.